welcome to What You Need to Know with Carla Pileggi Caviola. Today on our show, we will be talking about physical therapy and specifically pelvic floor therapy with our special guest, Dr. Hope Bove. Dr. Hope Bove has a doctorate in physical therapy. She also specializes in orthopedics, pelvic health for men and women, and TMJ dysfunction. She also has a special interest in women's health issues, including pre and postpartum care, pelvic pain, back pain, and incontinence concerns. It is a true honor to have you on the show today. Dr. Hope Bove, thank you for joining us.
Thank you very much for having me, Carla. I really appreciate it.
Absolutely. Well, I'm excited to learn from you, and I know our audience will be excited to learn from you today as well. Tell me about your story in regards to personally and obviously education-wise, how you got into this field.
So this actually was a career change for me. About 20 years ago, I was in another field and thought to myself, there's got to be a little bit more that I can do um, and be happier at doing it. And so I had thought about physical therapy for a while, and all of my friends who had gone into physical therapy as an undergraduate program all seemed to love what they did. And I thought to myself, wow, that's amazing. Imagine going to work every day and loving what you do and knowing that you make a difference and you can help other people. And that's sort of where my mindset started at. And from then, through the support of my wonderful husband, I was able to quit my job, went back, got my doctorate in physical therapy. And and then, a few years later, I have two other business partners. We started our own business in 2016. We've been thankfully very successful, and we're very grateful for that. And along the lines, shortly after I had graduated with my doctorate, I became very interested in, at the time, it was known as women's health. Now it's sort of begun more of a general term, sort of more pelvic health, because pelvic health, relates to obviously both men and women of all different ages and for a variety of different reasons. And the reason I wanted to get into pelvic health was at the time I've been treating pelvic health patients for slightly over 15 years now. And there was not a real tapped market on it. I had a few colleagues who were doing women's health and had very successful practices. And I delved more into it and started asking a lot of questions, started meeting with them, and they were really wonderful in sharing all of their knowledge. And I thought, this community is such an underserved population. And of those of us who are women, some of us have children, some of it doesn't, but that does not necessarily exempt us from having pelvic floor issues. And really, it boiled down to a quality of life for me. Having people come into my office, really being concerned about things that were changing in their body that they had absolutely 100% no control over. And it, of course, very devastating to them. And so I really made it my job, if you will, to focus on this community and really delve into knowledge, continuing education courses, and really trying to help with this underserved population. Thankfully, now it's becoming much more of a forefront topic, but for a long time it really wasn't. And there was very few people who worked in pelvic floor therapy. And so people were very, very happy to find practitioners who could help them. And it's nice to see now that the interest is becoming much broader and people are much more informed now and will actually seek out a lot of pelvic floor therapy, either through referrals from their physicians or through friends themselves, other colleagues. So it's been really wonderful to see the growth in the community.
Wow, yes. Wow, you certainly went on a journey from one career and then shifted into, it sounded so easy, but I'm sure, you had a lot of hoops to jump through, right? To get to
Yes,
finally your
yes.
doctorate and then eventually specialize in pelvic health,
Hmm.
right?
Yes.
Wow. So, for a lot of people, they might not even understand what this means, pelvic floor therapy or pelvic health, these are maybe newer terms to some people, like you mentioned, even within the healthcare system, if you will. Maybe some people are getting more referrals or understanding more about that now versus in the past. But can you explain to people, first of all, what is pelvic health? What is this, and what might be common challenges that, for instance, a mom during that period, that perinatal period, let's say, when bodies are changing, pregnancy, postpartum, and everything else. And certainly, like you said, it's not specific to birthing a baby, but what what is it, number one, and then what are the common challenges people would experience?
Sure. That's a really great question. So, pelvic health in general refers to the health of the pelvic floor, the health of the muscles surrounding the pelvic floor. One of the things I look at when I assess someone's pelvic health is it's an internal and an external components to it. You have to have the box, if you will, the core, the hips, the pelvic floor, the diaphragm, the back, the abdominals. Everything has to work in symmetry with each other. If there's a breakdown somewhere, it can lead to other issues that might now produce pelvic pain or back pain, or now all of a sudden maybe you're getting some incontinence with running. Just different changes that all of a sudden kind of come on out of nowhere. And some people get pelvic pain. Some people have a lot of burning and can't sit down. Other people might have difficulty with sexual intercourse. Other people might just have, uncontrollable incontinence. Some people might have fecal incontinence. And these are things that really literally, I won't say they pop up overnight, but they do happen. And it's very, very common. And this isn't meant to scare anyone, but all of a sudden you're going along one day and everything seems fine. And then for some reason, it isn't. And so when I say pelvic health, it's really about what is your pelvic floor doing? Is your bladder being supported? Is your uterus being supported? Is the left side doing what the right side needs and vice versa? Are they working together, or is one on a whole different movement pattern versus the other? You might be having digestive issues. You might be having elimination issues. All of that really falls into that umbrella term of pelvic health. So it's a pretty
Wow.
broad scope. And that's not all inclusive. Those are just some of the things.
Of course. Yeah, maybe some common challenges. And when, I work as a psychotherapist, perinatal mental health specialist. So a lot of the people I'm working with are, trying to get pregnant, currently pregnant, or maybe they're in their postpartum period, right? Which could last
Mhm.
a year or beyond if they're breastfeeding beyond that. What are the common challenges that you find women in that, specific time period in life might be facing, that they might be calling you about, or maybe get referrals from someone like myself, or like you said, the community or other providers?
So, some of the common challenges we see is, so if a woman is pregnant, let's say, the body will graciously move to accommodate the growth of that beautiful little baby that we're carrying. Sometimes one side will accommodate a little too fast or a little faster than the other side. And then all of a sudden we have, maybe there's some pressure on one side of the pelvic floor. Maybe all of a sudden sitting's not becoming so comfortable anymore. Maybe bowel elimination is becoming an issue because the baby's situated a little bit, more towards the descending colon or on the sigmoid colon. The bladder kind of gets squashed and pushed out of the way, and maybe we've got a lot more frequency now, or maybe some incontinence has set in, or sometimes it can be the reverse. Maybe now it's a little bit more difficult to go to the bathroom because you've got something sort of sitting on your urethra now. So it's those are really a lot of the different common challenges, in addition to backache or the pelvis shifting. And now all of a sudden your stance is a little bit different and you're walking just a little bit different because your feet are a little wider. Now all of a sudden that's pulling on the pelvic floor. And so now your pelvic floor is having its own issues. And now it's a little too tight or a little too loose on one side. So those are really, when someone is pregnant, a lot of the common issues that they'll experience. After birth, it can be a myriad of different things. It can be some, depending upon your birthing experience, and everybody has different birthing experiences. Even if you've had a C-section, your abdominals are now compromised. they can't support the pelvic floor. I have lots of women who have come in who have pelvic floor pain and never went into labor and asking me, why do I have pelvic floor pain? I never even went through labor. So a lot of that has to do with a compromisation of now the abdominals. They used to be in one form and now they're in another form. So now the pelvic floor is not getting that support it once had. So it's all about re-education of the body. And as far as a C-section is concerned, and vaginal deliveries, we want to make sure that there's as little scar tissue as possible in there because scar tissue takes away from muscle flexibility. We do have to have some amount of recollagenization so that the healing process can take place. But sometimes if there's too much scarring, then that's going to lend itself to other issues. And that's where perhaps sexual intercourse dysfunction comes in place. Or now, incontinence that was never an issue, even during pregnancy, now might be an issue because the pelvic floor is so tight because it's scarred over, it can't relax itself. And so therefore it can't help the bladder. So there's a lot of different issues that can come both pre and postpartum. And again, it's just another general effect of laxity because we have so much relaxant going through our bodies that'll stay in our bodies up to 2 years after we've delivered. And especially if you're breastfeeding, that's going to stay in there longer. And then that means people, or women in particular, are much more susceptible to joint laxity, to muscle laxity. And it's harder for the body to return to I'll say tightened state, using that word sort of inappropriately, but kind of going back to what their muscle length and space once was. Because now we've got all this relaxant in our body, and it's very difficult sometimes for that body, or maybe even one side of the body, to come back to what it was or what it needs to be in order to help that person function. And so, now we can get back pain when, moms are lifting babies all the time. And we all know trying to reach over the crib is, impossible, especially if you're, a 5'2" person like me and you don't have the height, and it's really a struggle. So I teach moms all sorts of different lifting techniques and ways to
Okay.
protect their bodies while their body is healing and getting it stronger at the same time.
Yes, yes. I've also heard of some women also having, the abdominal separation. Can you tell
Mhm.
us a little bit about that and how long does that take to heal? And
Sure.
that's the treatment you do postpartum as well, right?
Yes, it is. It
Yeah.
usually, sometimes if women have a larger diastasis recti, as we call it, and that
Yes.
separation, it can present itself during pregnancy for sure. A lot of times, unless it's very large, it doesn't present itself until after the birth of the child when things start coming back together again. And then we've got that little space that can happen above the umbilicus, or the belly button, as we call it, at the
Yes.
umbilicus or below the umbilicus. So it has three different parts of where it can actually take place. And depending upon the separation, the recovery is usually about 12 weeks for if you want to give it a quote unquote average healing. Some people are a little bit more, some people are a little bit less. And
Sure.
it also depends on the width. But we work to get that side of the muscles, the left and the right side of your rectus abdominis and your linea alba, kind of coming back together again and sort of sealing up or zipping up the middle, if you want to think about it in those terms, so that
Mhm.
it doesn't become a problem later on if you're having multiple children, or maybe this is your third or fourth child and you've never had a problem before, and now all of a sudden it might be present. So we do work with that and working with women to get that stronger so they can go back to doing things that they wanted to do, or exercises that they want to do, or even so much as just lifting their infants without discomfort and feeling like they have the appropriate strength to do so.
Wow. Yes. It seems like there's so many benefits in seeking pelvic floor, and it does seem kind of, in a sense, heart wrenching that maybe many people for many years haven't even heard about it, right? And maybe gotten the right help that they need. But what would you say the benefits are in seeking, physical therapy and pelvic floor therapy, especially for these pretty significant changes, right? That happen, especially like birthing a baby, pregnancy, postpartum, all of that physiological changes, and never mind other changes that happen. Because when you have a baby, everything really changes. let's
It's
let's
true.
let's be honest, right? So, what would you say the benefits are to, again, people that, again, this might be the first time they're hearing about pelvic floor health and pelvic floor therapy, that this is actually something that exists and is beneficial, that they don't have to necessarily suffer in silence.
Right. So I would say definitely listen to your own body, check in. There are some women who can also suffer from pubic symphysis separation during the pregnancy, where the pubic bone, the left and the right, there's a little disc and some ligaments in between holding them together. They're very strong ligaments, but sometimes those can start to separate and create a lot of discomfort. What I encourage women to do is listen to your bodies. Do you feel like your pelvic floor pre-birth is getting a little bit tight, maybe a little bit uncomfortable? Things aren't the same. Walking's getting a little bit harder. Just kind of listen to your body. What is changing? I always encourage women, if you are able to, seek a pelvic floor therapist prior to having your child, if you're able. Because this way we can sort of check the pelvic floor, check the hip position, and get everything nice and strong as it needs to be prior to delivery. And if there is some tightness or if there's some pain starting, we can address that so that when you go for delivery, that becomes the pelvic floor outcome on the other side becomes less of a concern. As far as postpartum is concerned, I would say, again, listen to your body. If things don't feel right, no one knows your body better than yourself.
Mm-hmm.
Think about, what do you need? What has changed? What's uncomfortable? What can you do now that you couldn't do before? What can't you do now that you could do before? And talk with your OBGYNs. And some of them are very, very versed in pelvic floor therapy. And some insurance companies require a prescription for physical therapy, some don't. And, talk with your OBGYN. If you want to go for physical therapy for any sort of the pelvic floor health, it's well within your right to do so. And it's very easy for them just to write you a prescription. All I need is a prescription from a physician saying evaluate and treat for pelvic floor. And then I take it from there. So it's really my job to deduce exactly what's going on and what
Okay.
do I see. And again, it gets back to looking at the body both from an external perspective and an internal perspective, because the whole body is, changes in that format. So don't be afraid to talk to your OBGYNs. And, if you want to come for physical therapy for the pelvic floor, totally fine. It's well within your right to do so. And you can even call my office or any office that you're seeking for that matter and say, look, I've got this in kind of insurance. Do I require a prescription? And many times the answer is no. You can just make an appointment, set it up for an evaluation, and come in and be evaluated, and we take it from there. So it's really
Excellent.
very easy to sort of be your own advocate. And I think
Yes.
there's a lot more knowledge out there in the medical profession that physical therapy for the pelvic floor is a necessity many times.
Yeah. Yeah. So that's really great. Now, would you also, I know you said it would be even more beneficial to evaluate someone prior to conception, right? If they're
Mhm.
thinking about getting pregnant. And then obviously there's the postpartum, but do you also you do work within pregnancy as well?
Absolutely.
So at
Absolutely.
any stage, pre pregnancy, pregnancy, and then postpartum.
Correct.
Yeah.
Correct.
Okay. Okay.
Because
Great.
our bodies shift so quickly. I mean, if you think about it, at no other point in time over a 9 to 10 month span does anyone's bodies change as quickly as ours have to accommodate for
Sure.
this beautiful little baby that we're carrying, or multiple babies, if if that's the case. And
Yes.
it's a shock to our systems. Our bodies know what to do, but sometimes they need a lot of help and a lot of encouragement to do what it is that they need to do. And so I absolutely treat a lot of women who are in the pregnant state. And you could come in very early in the pregnancy state, you can come in much later, or somewhere in between, just to make sure that everything is going great. And if it's not, then no problem. We problem solve, we identify what needs to be helped, and we help it. And so then the pregnant women can be much more comfortable and have a little bit more manageability over their own bodies. I mean, we all sort of kind of give up reign of our bodies a little bit when we're pregnant because things are going to happen without our control. But at least this helps us know what's going on and how to work with it. And it becomes much more manageable.
That's excellent. And it sounds like it's also, in a sense, preventative, right? Like if you start early on, you're
Hmm.
preventing potential furthering a situation or a problem, quote unquote, right?
Yes, yes,
So,
that's the main goal, is to be able to prevent anything from happening. I know that there's a lot of women
absolutely.
who are concerned about the birthing process. There's a lot of people who might be concerned about the diastasis, or that might be concerned about
Mhm.
pubic symphysis separation. We can address all of that during pregnancy so that it makes the labor and delivery much different and much less of
Excellent.
a concern. So it's
Yeah.
definitely wonderful if women can come in during their pregnancy as well, and we
Yeah.
can help them out and
Yeah.
get their body set up for success, as I like to say.
I love that. Yeah. It sounds like the sooner the better, right? To not just do treatment, quote unquote, but also the fact that you're really integrating prevention as well. So I love the
Yes.
fact that you can also be preventative as well. What do you find? I know you mentioned before that, and we've discussed it, that a lot of people might not even know about pelvic health, uh, pelvic floor therapy, all of these things. What do you think that the main barriers have been that have hindered, in this case, let's say women seeking pelvic floor therapy during all these massive changes, especially during, pregnancy, postpartum?
I think it's a lack of awareness mostly.
Okay.
A lot of the industry wasn't really in tune with the fact that there is pelvic floor therapy out there available. And it's something that is really sort of up and coming, even though I've been doing this for 15 years. Other people I know have been doing it for 20, 25 years. It's not up and coming to us. It's more of people sort of catching up with the things that we've seen and the things that we've treated. So I think that pelvic health really needs to move much more to the forefront of knowledge as far as awareness is concerned. A lot of midwives and doulas are very, very much on board with it. And there's a lot of really wonderful OBGYNs who are on board with it. But there is still a little bit of a lack of general knowledge out there of what pelvic floor
Okay.
therapy is. And it also can come in the forms of burning, and it can come in the form of chronic UTIs. It can come. So there's a lot of different aspects that can revolve around different things. And I've also developed a wonderful relationship with a lot of urologists in the area because of the fact that the pelvic health is so important in so many different avenues. And I say to women, just start asking questions, and really, it really starts with yourself. How are you feeling? Because as I stated before, no one knows your body better than you do.
Yeah.
I can give you guidance, but you're the one. I'm going to look to you to be the driver of the ship because this is your boat. I'm just here to help steer the ship, but you're the captain. And so it's my job to make sure that you get what you need. And so I encourage everyone, don't be afraid to ask questions if you're not getting the results that you want. As far as the answer to your question that you're looking for, go elsewhere. And start, maybe you have friends who have had some issues. Maybe, maybe it's your mom, maybe it's your grandparents. Um, just a general different community. Because I think when we start talking openly about it, they all become aha moments that then domino into a great effect. And I want people in this community to feel like no one is ever alone. You're never alone in going through this. It's new to you, which is absolutely 100% important, but it's also happened to someone else, and that there's a huge community out there. And I want women to know that and to be comfortable with that, because you're not alone. It takes a village, and it really does. And so I've gotten so many friends of patients, or moms of patients, or aunts of patients, or cousins, or nieces, or what have you, because somebody said something. So it just takes saying something, recognizing something, and looking for it. And you can even talk to your primary care physicians. Again, it's no big task to write out a prescription for pelvic floor physical therapy. It doesn't, it doesn't hinder anyone one way or the other, but it might make the difference to the patient. And just hearing
Absolutely.
people and understanding what they're saying, and knowing that you're not alone. Everything you're experiencing is very, very valid and very important to that person. And that's one of the roles that I play, is really listening to what people tell me, and and take it from there, because like I said, they're the captain of their own ship. I'm just here to help steer.
Yeah. And I love what you said, right? About just knowing having that awareness, right? About what's going on in your body and then being able to advocate for yourself and
Hmm.
really not have to suffer. This episode and this show is all about education, empowerment, and helping people to, realize that there is hope on the horizon. So if they are having any pelvic floor, complications, if you will, they do not have to just live with it for the rest of their
Right.
lives, right? There is hope on the horizon, and talking about it, the more we talk about it now, people are becoming more aware and educating them to be aware about what's going on in their body and advocating and finding the right provider. I mean, how might if there is anybody here on the show that might be struggling, or maybe somebody that they know, how would they find a provider that is specialized in you know um, pelvic floor, physical therapy and pelvic floor health? And
Sure. So I know as part as so I'm registered with the American Physical Therapy Association. They have a directory under it's now termed pelvic health. It used to be women's health, but now it's termed pelvic health. They could
okay,
go there. They could check with their insurance companies. Just even a simple Google search, pelvic floor physical therapy near me, will bring you up to a lot of different things. I know if you even search that, like I pop up in Google because it'll
yeah,
pull from my bio of things that I've done. And listed under the coursework, some that I've done will be different areas of where a lot of us are registered. So I would say, certainly start there. And I get a ton of referrals from moms' Facebook posts, like, oh, does anyone
yeah,
know? I'm now, I suffered an episiotomy. My pelvic floor is not quite the same. New moms, what can I do? And then it's,
right,
boom, 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 boom. Here are different things you can try. And someone's always on there. Oh, I've seen this one for pelvic floor physical therapy, or talk to your doctor about this, and or what have you. And so I think that there's, thankfully now in the age of social media, someone can even sort of go to YouTube and look up a podcast on pelvic floor therapy, and
I
here we might pop
know.
up. So,
Yes,
so I would say just really do your research, and it's a lot easier to do now than if of course it used to be, 15, 20 years ago. But, we're
yeah.
out there.
Okay, so it's not so hard as it used to be anymore. So that's
No,
a good
thankfully
thing.
not.
Good thing that's one of the good things the internet offers us today, right?
Right,
That's
right.
awesome. And I guess for any viewers here, if anybody would like to reach out to you regarding your services and where you're located and licensed, what would be the best way for them to contact you today?
Sure, that would either be probably through my website or calling my office. So my office is called Total Body Physical Therapy. It's located in Norwalk, Connecticut. It's right off of 95, so it's pretty conveniently located. And I'm licensed in New York and Connecticut. And you can go on the website. You can email. Certainly, calling the office. My business partners are very well versed in what I do, and whomever answers the phone can certainly talk to you, answer any questions that you have, leave a message for me. I can get back to you with any questions that you might have. I'm very happy to speak with anyone who really feels like they need help. And if I'm not the right practitioner for them, chances are I can point them in the right direction for someone that might be. So I think that that's very important too, is I really keep my colleagues um, nicely tightly knit in my community, and I work with a lot of different people, chiropractors, functional medicine. We have a nice, as do you, it's a nice broad basis, and one usually lends itself to the other. And I am
Mhm.
always happy to say, who I think would help great with this. I want you to, give this person a call, talk to them. And I think that that's really important, because the more information we can provide someone, the better off they're going to be.
Absolutely. Yes. Well, I that is amazing. If anybody does need to contact Dr. Hope Bove today, you know where to reach her. She's an amazing physician, and again, it's been absolutely amazing having you on the show today. You've given us a wealth of information, a lot of golden nuggets for us to think about and to pass on to others, to our family, friends, and just our community wherever we are, right? And like you said, you're located in Norwalk, Connecticut, your practice. But certainly, if our viewers are out of state, out of country, or wherever they might be around the globe, there's definitely, it's all about finding a provider close to you that can help you walk through this. So you don't have to suffer alone, and know that there's hope on the horizon, right? That this can be treated and even prevented, you know, severity of cases and so forth. So, Dr. Bove,
Absolutely.
again, it's been an absolute honor and pleasure to have you on the show today. You have provided us amazing information and so valuable. You've added a lot of value to us. So, again, I appreciate you sharing about your expertise and clarity regarding therapy and pelvic floor therapy today. Again, for any viewers out there, if you would like to reach out to Dr. Hope Bove, you can contact her on her website, totalbodyphysicaltherapy.com. And if you have found this time to be educational, empowering, and insightful to your health and well being, please click on the button below and subscribe to my channel. Also, please feel free to share this, like we mentioned, with your family, friends, and anyone who might benefit from today's episode. Thank you for tuning in, and I look forward to sharing with you next time what you need to know.
Thank
Take
you,
care.
Carla.
Absolutely. It's been an honor and a joy. Thank you so much. Take care and be well, everyone. We'll see you next time on What You Need to Know. Bye bye.